that we can safely protect them.
You're listening to the Curious About Cannabis podcast. Special thanks to our current annual educational event sponsors, including The Workshop, CBD National, and Green Earth Medicinals. If you want to learn more about our Curious About Cannabis events, go to cacpodcast.com/events. And if your company would like to become an event sponsor, visit cacpodcast.com/sponsors to learn more.
It's a weird year to be in cannabis, I would say. And I think like it reminds me of 2020 and the pandemic when like I was really busy and the lab was really busy and the rest of the world wasn't, you know? And it kind of feels like that right now for me in the cannabis industry, where like a lot of labs are closing, a lot of businesses are, you know, shutting their doors forever. And like, we just keep getting busier and keep getting bigger. And like, so, you know, like where the growth is happening, it's happening fast.
Yeah.
And in the rest of the places, you know, it's just a lot of change, you know, which like, I love to rearrange my furniture. I love to experience anything new. But it is a weird time for this industry because, you know, we are like seeing all of the things that we expected to, you know?
Exactly. Yeah. It's like all these things that we predicted from the beginning. It's like, oh, we're finally living in this, you know, this period where everything is maturing, and it's painful to watch because it's like people you know, that are going through all sorts of crazy stuff. And
absolutely.
It's definitely been a crazy, ever since 2020, it's just been weird. Every year's been weird. I don't know.
Right. I feel like the pandemic gave us like an extension on like the kind of sweet spot of like getting high prices and, you know, being this weird in demand and overvalued product. I think that the pandemic gave us like a little bit of a stretch, and that maybe we would have been here where we are right now in 2020 if that hadn't happened. You know, but it's hard to say, of course, you know. I feel like for years, you know, we've been saying this is going to kill farmers in California, and it took years, but it did. And, you know, same thing with testing. We've been saying for years, we need testing. And then everyone says, but the labs are bad. And, you know, finally states are requiring testing and requiring accreditation and actually holding labs accountable and actually shutting them down. And, you know, like all kinds of things are, you know, just like I said, none of it's a surprise. Everyone said it. Most of us were ringing bells trying to raise awareness, and just now it's actually happening. It's total.
Yeah, it's interesting. The past year, I've seen several big articles come out about cannabis testing fraud, and I'm like, this is great that you're highlighting this. Wish you would have highlighted it like 5 years ago, 3 years ago.
Right. It took just long enough that like we're still mad, you know, like it still isn't good enough because you know, we're like, well, you know, where was this when it was affecting me, you know?
Right, when I was going through hell. All this.
Exactly. So it's a tough place to be, because I see so much struggle in the industry, but I also still see all of the potential that we ever had before. You know, what's exciting for me is that public consumption finally is a thing in Colorado in teeny baby steps, but like the very first license where you can sell cannabis and consume it on site has passed. That business model still kind of sucks because you can't bring in your own cannabis to smoke. Just like at a bar, you can't bring a sixer. But like nobody knows how to do that yet. You know, nobody knows how to like not bring their own pipe. You know what I mean? Like
at a bar, you can bring your own cigarettes. And so
right.
It's like a strange in between.
Yeah, but like you can't, you know, you don't bring your own glass to the bar. You don't bring your own booze to the bar. And that's, you know, kind of the same thing with this model. So it's like you can't bring your own Puffco. You can't, you know what I mean? Like you end up with all these weird rules that, you know, in time and with, you know, just consistency, we'll get used to it. But it hasn't been a thing yet. And then the licensed consumption lounges that are only bring your own.
Yeah.
And they have no sales. Those are starting to show up now. So we've got a couple of those that are licensed, but it's starting to have a structure, and that's exciting for me because it's kind of the next step, I feel, for like the retail landscape. Because we've spent a lot of time pretending that it's all about medical.
Right.
And like medical use is extremely important, but we have given zero attention to real medical problems as an industry.
Yeah, I know.
Lots of research is being done. It's not being done by us.
Yeah, if we took medical seriously, like, there's a number of things that would have happened
that would be different
a long time ago. Yeah.
Exactly. And so, so I am excited for that change, for public consumption to like become an established thing, because I do think it's the next evolution of the retail landscape. Like we have the liquor store model now. Great. And so the next move, I really think, is figuring out how do we socially consume and how do we make like a bite-sized social experience, like a drink at the bar, out of using cannabis. And I think that that'll be really cool. And I think it'll actually benefit medical usage, in the same way that, cigarette taxes, support lung cancer research, like we have ways to fund some of these things. So I do have a lot of excitement about that change for Colorado and for all states. Like when I think about Vegas, like if I could just smoke weed in that casino,
right.
I might want to go. I might want to stay in there longer. You know what I mean? Like I don't. Yeah, because all I'm trying to do is figure out how to get outside of those complicated buildings so I can smoke. And so being able to, bring that experience around, that's the thing that I think I'm the most excited about going forward, because I think everything else will be about standardization and compliance and scale. And, those things are like really cool if you're succeeding at them.
Right. Yes.
and if you're not, it's it's the hardest part of the job. So
yeah. Well, and it's funny, it's taken Colorado this long to get to this point. I mean, I always expected to see it happen, at least like 4 years ago or something. And it's all in all, I've been a little surprised by the resistance in not just Colorado, but like Oregon, California, and other places. The resistance to, public consumption. It's just, and it's something that was always going back to the early medical days. It was always this weird thing of like, all right, it's legal, but you have nowhere to do it. And especially if you're in an apartment or something where you have very little control over your situation, and if you have a shitty landlord who just doesn't like it, then you just basically have nowhere. It's odd to me that this has taken so long to finally get some traction. And
it's a definition thing. I think that what people really struggled with was and like I don't mean to dilute the value of medical use, but we really did legalize recreational use with a medical name. Most of the products, most of the consumption methods, most of the trends in the industry don't have anything to do with medical efficacy or ease of use, because frankly, like being able to smoke with your homies isn't important if it's medicine. Like no one is taking insulin and saying, well, why can't I like have an insulin bar with my bros? Like, it's just not the same, because like that's not the usage. It really is more of like an all day chronic application, or it's like I have a migraine and I'm staying home and I'm not talking to anybody, So like for a lot of the people who really do have a medical application, the public consumption wouldn't have helped them. It was always about access and information and product safety, and for everyone else, it was a better alternative to alcohol. And a lot of the therapeutic value, different than I would say like straight up medicinal value, comes from the social benefit of using cannabis instead of alcohol. or instead of just your own anxious self, whatever
Right.
your, that pre-existing condition is. And so I think, it's a really tough thing to backtrack on for us as an industry, to say, like, because what we meant was no one should go to jail, but what we said is, what about cancer patients? And
Exactly,
it's like, let's just start with everyone safe, and then work it down to, like, here's what you need, here's what you need, here's what you need. Let the people who need it the least pay the most to take care of the people who need it the most but can afford the least, and we could balance it all out. But we started on the low end, and it's hard to build from that. So it makes sense that it took so long. It just is unfortunate because it puts us at odds with our roots, know?
Right. Oh, big time. I mean, I've seen in the past several years, there's, and I think we mentioned this a little bit when we were, texting on Instagram, that there's kind of like a weird vibe now around all of the folks that kind of got into the industry around the same time, really early, in 2010 and 2013 or so.
Right.
That really got in and have kind of ridden all these waves. There's a strange kind of angst that has built now in a lot of these folks. I feel it, where I'm like sitting here watching everything that's happened, and I've got really strange mixed feelings about it all. And there's part of me that's like, I'm happy access is increased, and obviously any step forward is good, but there's been so much just weird missed opportunities and things. Like, I'm glad you kind of distinguish the difference between medical use and therapeutic use. A lot of folks would say that's the same, but I actually like that subtle differentiation.
It's subtle, but it's everything. Think about the things that you use therapeutically that you can't call medicine. You know what I mean? Like an ice pack. You know what I mean? Yeah.
But it's not treating a disease or treating a specific condition.
And then it's not chronic, which is what opens you up to this potential for self-medication that's responsible. Because self-medicating anything chronically, I would say, is maybe not something that any of us are in a position to decide.
There's risks and nuance there. And going back to the public consumption thing, that ties in with a lot of this. I hope that it drives a public conversation around, like, what is even adult responsible cannabis use? Like, what does that look like?
That conversation, it really comes back to a conversation about intoxication. And it's been, I think, the standard for us as at least as an American society, to look at the difference between intoxication and like high, or, there's kind of like both are bad, but like intoxicated almost has this implication that it was accidental, that that there was an appropriate amount of it that would have been okay, and you just went a little too hard. Whereas like being high almost implies that like at all is overdoing it, right? And then you look at like just the substances that we're out there consuming every day, and like someone saying that coffee makes them jittery and then they drink it anyway. Is that high or intoxicated? And if someone takes like if we're looking at alcohol, if someone drinks like hard alcohol out of the bottle versus someone who has a can of beer 100% of the day, you know what I mean? Like is just constantly drinking it. It's like, and so we tend to like look at that same substance and different uses of it, but potentially even the same chemical accumulation and the same level of intoxication or highness. And we give it these like social appropriateness factors, that kind of just are all rooted in like, is the activity that you're engaged in social or not? Because that's really, if you look at alcohol, and even with the way cigarettes originated, what makes it okay is you can do it with other people. Like you can drink a lot and binge drink even if it's with other people and you're fun. But once you do it at home by yourself, then it gets weird. Or if you're an asshole, right? And so it's like that social nicety is a really key component of the social consumption that we haven't really addressed. And I don't think it's because people don't want to be around people that are high. I think it's that we have this pre-existing idea in our mind that because people do it by themselves at home, that's high. And it's not like catching a buzz, you know? So like, since it started out as this sort of solitary at-home secretive behavior, it just like got lumped into that category. Whereas like, you know, you can take your painkillers or do all kinds of other interesting substances. And if you're good socially on that substance, it's kind of allowed. And that's what's so wild, is that we're all better when we're high in terms of being around other people. It's probably slightly better, or at least the same for most people. You know, there's very few. I
generally hate other humans a lot less.
Right. Yeah. And that's what's so exciting about all of the psychoactive changes in regulations lately, is that, you know, it's been easy to brush it off as unimportant to address, you know, social consumption and like how people can get high socially, because it's also fairly harmless. So like when we just do it anyway, you know, no one's really getting hurt. Might be getting super high, but when we get into psychoactive substances, now like that social contract is more important than ever. And I think it's going to force us to start really talking about it.
Well, and it's funny, as we talk about this, it highlights a funny thing about, you know, social groups and things, that we really only care about someone's substance use if it bothers us being the society, the group of people, whatever. And it's a shame because, you know, obviously there's so much more there around substance use that we need to talk about and think about and be aware of. But it's just kind of it's like an extension of our egos in that sense, but on a group level. It's like, well, as long as that person's not annoying us or bothering us, as long as they're fun to be around, then we don't really care how much they're doing or what they're doing.
Yeah, as long as the net impact is positive for me, I don't care what you do. Which is it's an interesting position to come from, because you know, when we get into the psychoactive substances, like everything that's, you know, because I just look at mushrooms and all I think is like, please don't do what we did with weed. Like, please do better. Oh my God, please do better. There's so much opportunity, and we have so much experience in doing it in many different versions of the wrong way that like, we could do such a better job with psychoactive substances if we wanted to. And just the very nature of them forces us to have a conversation that's pretty literal about like a state of consciousness and the social contract that's involved in that. Because, you know, that's, you know, when we're talking about someone going on a trip or someone literally altering their consciousness, you know, in some pretty dramatic ways, it allows us to discuss the extreme in a positive way, which makes it so easy to then say, and so, smoke a joint on the outside smoking deck of the baseball stadium. You know, like, because it's so much easier to come back down to that conversation.
Comparing
when we sit up here and discuss like, okay, so how much peyote should a person be allowed to possess when they're dispensing it to other people? And we start to have these like crazy conversations about that. It makes it, you know, it kind of it minimalizes all these others. And so, you know, I'd rather see decriminalization for psychoactive substances simply because we're not in a position to decide those kind of regulations and restrictions. But I think the conversation is really important because we really don't talk about it much. And what we'll find if we talk about it more is that we need more data. We need more research. And if we need those things, then what we really need is more money. And, you know, and that's the thing that the cannabis industry can still do. You know, we can still make money. You know, the fact that farms are closing does not mean we're selling less weed.
It's just the market saturation is being dealt with.
Exactly.
There's been too many players involved, you know, and it's the natural evolution of an immature market. That you end up with way too many players, and then consolidation happens over time, and that's where we're at. And Yeah, I agree. Psychedelics have to be treated totally differently than the cannabis industry. And if they do get treated the same due to, kind of loose gray area legislative changes that happen in states, it's going to blow up in our faces so fast. Because there's such a greater people don't like to, it's like cannabis, I'm talking about risks. I'm already getting nervous of like what kind of feedback I'm going to get. But the risk profile of psychedelics is so much higher than cannabis when we start talking about, not only how it can affect your psyche and, your mental health, but when you're going into public, all of the different variables that come into play there. I mean, it just is. Compared to cannabis, there's a humongous difference in the potential things that could go wrong.
Yeah. I mean, there's genuine harm that can be done. And, we can't, I think we got away with a lot of laziness in our regulations, in our product development, in our, just the development of our industry. I think we have really been able to, get away with not trying as hard as we're capable of.
Absolutely.
Because it's just so safe, I mean, 33 people died of unknown vaporizer related illnesses that collapsed their lungs. And what has that done for anything? There's a few states that don't allow additives.
Right.
There's 2 states that say cannabis ingredients only.
Right.
And they don't verify that in any of those states in any way. Yeah. What would you do? If I watch the cannabis grow from start to finish, harvest it myself, extract those terpenes, and then test it, I can still barely give you a mass balance report on what's there.
Right.
And so it's a really strange, kind of position to be in when I look at the cannabis industry, to say we are not we shouldn't check our own work. Someone else should, but we do. We check the work, we write the work, we edit ourselves, we do all of it. Yeah. Mm-hmm. And so that, that accountability factor is really missing, but people don't think it's missing because bad things generally don't happen.
Right.
That lab put out millions of tests for in Michigan for microbial content, total yeast and mold, and so those are the things that from the medical perspective, real important, right? I really don't want
actually matters.
Certain, can I not have E. coli on my weed? I don't know what will happen if it's there, but I also do not want to find out. There's some things that are genuinely important, and that's an easy one to just say, we all agree, we don't want, this microbial content, but so many samples came out of that lab that weren't tested at all and that would have failed potentially. And nobody got hurt.
Mm-hmm. Right.
Except the labs and the businesses and the people who paid money for that testing, so the consumer was relatively safe. We haven't had to deal with a product liability case.
Not in that
matters.
It's not like you see where, these, batches of lettuce are contaminated with salmonella, and there's been hundreds of, food poisonings, and several of them have been fatal. You don't hear that kind of stuff come out of the industry. And we've, even though the industry is still limited to a handful of states, really, in terms of full adult use legalization, there's a lot of data now. I mean, and sometimes the lack of data is data itself, in the sense of the lack of any sort of thrilling emergency. I mean, the fact that E-Valley got so much attention and that really didn't affect that many people.
Right.
And it was corrected fairly quickly. If there were other things lurking, they would be blown up. I mean, if it's there to be reported on and blown up, it's there. And it's several years ago, I used to talk about mycotoxins a lot more. And I was like, we don't know about mycotoxins. There's no data. Well, now, California and several other places have been testing on them. And it's okay, in general, mycotoxins don't seem to be a big deal in cannabis. They show up sometimes, but now we have the data. It doesn't really seem to be worth worrying about that much. That doesn't mean start blasting moldy stuff all the time, but it does show that in general, as the industry is taking care of itself and running along,
right.
It doesn't seem to be a big health issue. And so it's, once again, going back to like where we are now, having like watched, we've basically watched a decade or so of the industry unfold and have participated in that. And it's just really, really interesting to think about where we are and the conversations that we need to start having, that we're ready to have now that, that we're seeing that the main things to worry about with cannabis, pesticides for sure, metals in vape cartridges. But now it's like, well, we know the manufacturers that make good vape carts. So it's like, you don't have much of an excuse anymore if you're a producer. There are like three main ones that you can use that you'll be fine with.
We've kind of just, like enough time has passed. Like you said, it's been an actual decade. So now we have this bubble where we need 10 more years to go by to find out if there are long-term side effects, because that'll be the next wave, right? So like what we're not seeing are like random occurrences of deadly risks that would be those short-term crazy, environmental issues, like we're not going out and eating raw broccoli. So we're not dealing with, salmonella risks the way that we might otherwise. And just the testing alone is probably sending a lot of that material to distillation and kind of, sort of self-regulating in that way. Right. Which is great. But then, we do have the next category of long-term side effects, because when you look at cigarettes, short-term side effects are fantastic. Lose weight,
exactly. 5 years in,
like reduce your appetite, lowers your stress. I mean, are you kidding? Make new friends. It had such great short-term benefits. And people used to not live long-term. So the long-term benefits, just looks like being old. They just looks like being 45. Everyone died, So now that'll be the next big bubble, which is where I think we'll start to find out, because like I like you, I was like, oh, we don't even test for mycotoxins. So like, what are we doing testing for fungus? Because if the fungus is there, all I want to know is if there's a mycotoxin, right? Like the fungus doesn't concern me compared to the mycotoxin. And so, but similarly, I've never seen a mycotoxin come up on any test of material I've ever run before. Because I feel like you probably just have to have a lot of perfect conditions to, to foster that. And it's maybe easy enough to avoid. Right.
I mean, people in general are not going out of their way to find cheap moldy material to
it's kind of like once so then you start looking for it. Like if you hear that salmonella is on broccoli, you just start washing your broccoli.
Right. Exactly. Yeah.
Not a big deal. Now you're fine. Now you can have salmonella broccoli and just wash it off, Yeah, exactly. So it helps a lot, but then that leads, to the next sort of category. And so then I have to start thinking about, because if there's a long-term health risk, it's going to come from manufacturing. It's going to come from what I'm doing. So now it's the metal accumulation from edibles. Now it's terpene combustion.
Yes.
How much benzene does it take for you to develop cancer that we can trace back to dabs? How much of a neurotoxin,
What does it take to strip the mucosal linings of your lungs? Like how much exposure to high concentrations of terpenes and stuff does it take to start to degrade some of that, which then you would expect to see higher frequency of infection rates and stuff in people that are chronic users. And I agree, that's really going to be interesting stuff to see. And something I've mentioned to folks too is we have a long history of interacting with the flower, but interacting with all of the types of products that we have now, it's just different. It's just new. We just don't know much.
Well, and we keep pushing for bioavailability, right? Like, So if we nano emulsify everything, if my cannabinoids are more bioavailable, is the lead?
Right. And it's like, your body seems to tolerate the components of cannabis well in herbal form, and it seems like people have been exposed to hashish and stuff for a long period of time, so it's not like we haven't been exposed to concentrates. But yeah, it does really start to kind of make you wonder what we're going to see on the other side. And actually, this segues into something I wanted to make sure to talk to you about that just popped in my mind. I want to say it before I forget.
Sure.
It's not really, it's probably not so much related to user safety. Maybe it is. I don't know. You'll know more about this than I do. But I wanted to make sure to talk about Medusa stones and everything that has circulated about that, because people are starting to understand why their diamonds are coming out sort of chalky and cloudy and that sort of thing. So totally unrelated to what we've talked about before, but I want to make sure to hit this.
I mean, maybe that's
the thing. Yeah, we don't know.
we don't know. So that kind of goes back to like the accountability conversation we were having, which is like, we have this chain of custody with cannabis of like who holds it, but somehow the chain of accountability is not consistent with who's holding it. Right. Like if something goes wrong, it's because of who had it last. It's not me.
Right.
Like it has to go to. Yeah. Like I'm doing a great job and someone else did something. And so when we're just talking about, growing and harvesting and packaging cannabis, that's still potentially 47 touch points, like tons of human interaction, tons of distribution, tons of temperature changes, container changes, like so many things can occur. And that's just if we're going to keep it in the flower form as we trimmed it. When we get into manufacturing it, touch points, my God, people are touching everything so much. So
many
they're touching it all. Yeah. And so every time that you change jars, you introduce, run it through a tube, tighten a gasket, like someone following the exact same SOP as me, but that isn't me, is going to have slightly different outcomes in one area or another, even if it's just how much oil they get out of the jar when they scrape it versus how much I do. I might call 49.9 pounds 50 pounds, and someone else might call 51 pounds 50 pounds. Right. And that's a huge difference if we're trying to calculate, certain things. Some are more important than others. And so when we get into the Medusa stone, the backstory is essentially that, and as far as I'm aware, this started in California. And I started hearing about it about a year and a half ago in California.
Yeah.
And it started right after the benzene issue in California, which was primarily in the Bay Area and kind of traveled north and then eventually a little bit south. But what had happened is, thankfully, California has a lot of testing requirements. But unfortunately, those testing requirements are such that there's this huge like batch requirement and quarantine situation, which forces people to test things when they're completely finished.
Right.
And kind of all at once, which is important to think about because a lot of time passes in between when you make a product and when the final tests for that product to be sold come back to you. And time is everything in the lab because you can do everything so quickly. And so with that, what had happened is a bunch of people ended up with benzene in their product. So that's not good. The safe allowable dose for benzene is none. It is cancer causing, will mess up your like DNA. Frankly, I don't know. Like it's not good for you.
And it's very rare to show up on a solvent test. Yeah.
Right, but it's also a tiny weird little hydrocarbon. It's not easy to like put in a jar. It's not easy to retain. It is, volatile, not as much as other things that we deal with every day, but it is not trying to stay.
Yeah.
Like it wants to go somewhere in almost any condition. Like you really have to give yourself a perfect set of conditions or so much surface tension and so much of it to really have it show up, because for most analytical testing labs, their lower limit of detectability and the passing quantity are like,
right, they're usually the same.
We're talking third, fourth decimal points. Yeah, they are so close that presence is a fail in most cases. Yeah. It's hard to have it show up. However, it's abundant and it's common. It's out there in the world. There's benzene in this room, it's a thing. And so when it started showing up for people, it had this huge financial impact. But it also, had this huge, forensic investigation issue that it posed, because there are a couple of places that we know it could show up, and there are a couple of places that we never, ever, ever check. So, for example, nobody does residual solvent testing on their flower.
Yeah, right.
But if there was benzene being produced as a byproduct of these, terpenes that are being produced by the plant, then it's absolutely as possible to be there as anywhere else. It's just, you can't see it. It's, it's such a small concentration. It's so diluted. It's hard to look at. So we don't really start testing for benzene until we get into concentrates. Right. And once we get into concentrates, and especially if you get into vape pens, if you start to get into flavored things, if you start to get into food, oh my God, there are a million, like your vanilla flavoring, probably benzene, like everything has a little bit of some of it. And so, if you've got like old ethanol that you've recovered 100,000 times in your roto, turned all the way up, running at, 200 degrees, and there was a little bit of terpenes in that you just recycle over and over and over, like decarb waste, like there's so many places where it can come from. Let me tell you, the weird shit in your cold trap when you're out there distilling in the world, there is stuff going on, and a little bit of back pressure to put that into your product could put it there. So like there's so many places it could come from. But with cannabis, what we like to do is blame somebody else. And so everyone blamed the gas, because butane and propane are tested for benzene prior to distribution. Yeah. So everyone in the Bay Area, sort of identified, because what it was is like, one or two labs had it happen to a significant enough batch that it starts getting talked about.
Yeah.
And so eventually it was sourced back to some batches of solvent that had benzene in them. And so, what'll happen, especially with the solvent being as volatile as it is, it's easier to evaporate butane and propane than benzene. Yeah. And even though I just said it's, easy to evaporate, they're even easier. And so what would occur, and this is especially true for high volume labs, is that if you have a little bit of benzene in all your tanks, that can be accumulative in your system. And if you have one tank with a bunch of benzene and all the rest are clean, that can still accumulate in your system and therefore in your product. And so, so there were some instances where people had no test data on their solvent because no one's checking or even asking for the COA.
Yep.
And this is an instrument grade product, which literally, is inherent in the name, but like it's not cleaned for human consumption because it's intended to be used as fuel.
Yes.
Be burned.
Yeah. And which
like into the world. Yeah. Into open atmosphere, 70% nitrogen. You know what I mean? Like into, like a totally different application than the way we use it, which in my opinion puts all of that responsibility on us and not on the gas manufacturer. Because if I wanted research grade, which is verified to be free of those things, I could buy it.
Yep.
But I don't. So if I'm going to buy a lower quality, it's on me. It's like if you put the lower quality gas in your high end engine, that's on you. That you're taking that risk, and most gas will be clean enough and it'll be fine. Some of it won't be. And that's what happened to some of these labs. They got a good deal on a tank from somebody. They got a good deal on a contract. They ordered something in a pinch, wherever it came from, however it happened, they ended up with this benzene. And because they were able to trace it back to the gas, Now we have a good scapegoat going forward. We used to blame the farmer for everything.
Right.
You know,
Suppliers.
because people were like looking at like what is benzene in some of these pesticides? Probably, but instead, but we found it in gas. And so then we move forward from there. So now a little bit of time has passed. People are paying attention to COAs, demanding it from their suppliers. The thing is, their suppliers are all distributors. Gas comes from like 3 major ports in America. There's not a whole lot of like the differences literally come down to like the trucks it gets transported on, the tanks it gets delivered in. It's not the gas, it's the containers. Container changes matter a lot. And so depending on how many container changes occurred, what the condition of those containers was, you end up with all these potential touch points for the gas to become contaminated. And so anytime you're getting something more directly from the source, probably a good sign. And that was good because it did tighten up kind of the weird people slinging tanks out of the back of a random grocery store situation, right? And that's probably for the best. Yeah, exactly. Yeah, because and that's it though, is like you have guys that like there's plenty of people out there who like sell like welding supply gas, and like they just buy a big tank and fill tanks in a parking lot somewhere.
Literally,
and don't care. And if you're just burning it, maybe that's okay.
Right.
I mean, you put dirty gas in through somebody's welder, and they're gonna notice it before someone will notice it in their closed loop extractor. I'll tell you that. Like they're paying attention. Yeah, exactly. So like that accountability is so important. But for some reason, we love to put it on someone else in this industry, and so we put it on the gas suppliers. So now people are paying attention to their gas. And they're worried about these minor contaminants in the gas. And what we discovered in that benzene scare was just like the fact that gas isn't being tested, right? Like it's being tested for stuff they knew they needed to remove based on DOT regulations,
right?
And for the ingredient you're paying for, so like there's sulfur in all butane. Just a little bit, comes from the middle of the world, from the lava center of the planet, so we end up with these trace contaminants, and most of them aren't being tested for. And the only ones that we're gonna see show up on tests are the ones we test for. And we're only testing for like this weird short list of solvents based on what we told the state we might use, and what the state heard from someone's Department of Health is definitely dangerous, so we've got these like weird amalgamations of rules based on what we self-report, what they impose extraneously, and and then a little bit of like this cross industry information. Because when we look at something like ethanol, and like we've got these food grade versus isopropyl versus methanol, like we've got all these real obvious differences and these different grades, and it's so much more clearly defined based on its usage. But with these compressed gases, there just really isn't a lot of usage similar to what we're experiencing. And so when the Medusa stone phenomenon started picking up traction,
which explain what that is in case anyone's unfamiliar.
Yeah, so what that is someone who is crystallizing THCA is recognizing that the crystals are growing in a slightly different formation, which is important. And that when they remove the supernatant, when they remove the liquid from those crystals, the crystal structure falls apart. And by that, I mean, it either grows differently or like physically crumbles. And so what will happen is the crystal will like get all cakey and powdery and crusty on top. Or they will start growing like a weird kind of like almost cauliflowery formation in certain sections that people would say is out of nowhere. And what it is a variation in their SOP, and that variation could be caused by a change in their gas. It could be caused by an accumulation of many factors in their system over time. It could be caused by an individual batch. And, the difficult part of all of this comes down to like the forensic data that we just don't collect.
Right. Until you
proactively.
Yeah.
Right. And so then all we get to look at looking backwards is, the little scraps and pieces that other people put together for us. And so the Medusa stones are a problem, unlike the benzene scare, because this isn't a, like toxic contaminant issue based on the contaminants we test for.
Exactly. Yeah. That's
and the toxicity that's been recommended. That's not a claim I'm making. Don't at me. So it's not a benzene thing. It's not a thing that, like the product's going to fail and I'm going to lose all my money. However, what it is not the product that I want to sell, because I'm trying to grow a pretty crystal. Yeah. I'm trying to grow a perfect diamond. And, crystal formation and crystal growth and crystallography and, just like that whole category of chemistry is the one category that's the least chemical and math founded, compared to most of the rest of it, because there are so many factors that you'd have to be able to consider and control for at any given time. And so, what chemistry is good at is predicting outcomes based on electromagnetic forces, based on polarity, based on, predictable factors. Whereas, the way that I think about, studying crystals and that crystallization process is that it's more like probability and statistics, because you do have almost at any given time two ways that something could go. And then it's just about like, is it more likely?
Unknown, uncontrollable variables that you can't get your hands on.
Yeah. And it's not, uncontrollable in theory, right? But it's like the ideal gas law. Like you don't have ideal gas. So like there are hundreds of equations that are like filling textbooks all around this world about ideal gas law that are for what? For nothing.
It gives you a baseline to think about it conceptually.
You can apply that to your black hole predictions, because like it's not relevant to the barbecue cylinder that's in my backyard. So we end up with like this this conflict between the theoretical possibility and then like the real world, real time experience that we're having in the lab. And so when I look at the Medusa stone issue, what I love about it as a problem is that there is no single identified compound. And it's been a problem that's been being discussed for a while, because it happens to anyone who extracts for long enough. Yeah. At a high enough volume. So it's not super common for people who are doing like single source and small batches. It's happening to people who have high volume toll processing accounts. It's happening to people who, are running, thousands of pounds, like it's happening to these bigger accounts. And what I think is interesting about that is that anything that doesn't happen to those type of processors, we will never hear about. Yeah. Because it's a financial issue. If your small single source farm grows a batch of diamonds that are kind of ugly, they just like get over it. They don't sell them. They whip it into batter. They don't think about it, right?
It into something else.
And the whip it into batter is an important point too, right? Because if you're not toll processing and promising someone diamonds, then you can just make this different texture. And so for a lot of people who are just trying to produce a ton of crystals, the same product that has a Medusa stone in it as a crystal would still have the thing that makes that Medusa stone if they whipped it into batter.
Right.
You just wouldn't see it.
You wouldn't,
because it wouldn't coagulate in one corner and look at you the way that Medusa stone does. And so, as this is, kind of being uniquely experienced by all these different labs, what's so funny about it is that everyone has completely different circumstances. So it's not one farm where everyone's getting this material. It's not one region of California. It's not one supplier of gas. It's not one type of extraction system. It's not one ratio of butane versus propane. Like there's no string that's holding it all together, except, in my opinion, the fact that they're all labs that are basically running every day and have employees. It's not a lot of small businesses. And so, what we've seen get blamed over the past year or so is, first of all, bad gas. So people just switch out their gas.
Would be a big finger at.
So what's interesting about that is if you take those Medusa stones and you dissolve them in pentane, the contaminant comes out in the supernate and it comes out in the pentane.
Interesting. So you should see that, yeah.
And so in my mind, I'm like, well, great, give me the waste. Let's figure out what that is, because I suspect that it's an accumulation of fats in an area of your crystallization, and those fats could be present in all of your batches, and the addition of a solvent makes them coagulate or crash out at a different time.
Have an affinity for each other.
It could be a pH change based on some think like an enzyme or a protein, like something that degrades once it's oxidized. So it could be a pH change that then now illuminates that one section. There could be a bunch of different things contributing to it. But there still hasn't been any analysis on like, if I take that weird white powder, what is it? And in my opinion, what's more important is what's in all of that liquid that we removed.
Right, exactly.
Because when we get the THCA to 99%, I can go very deep on what's in that other 1%, but like, okay, how about we go and look at all of this other mass that I removed first, and just start knocking some categories off. So I have heard that there was pentane being stored in cylinders and then they switched cylinders. I have heard about methanol in cylinders, which is interesting because methanol is actually like a common solvent in propane cylinders. So residual methanol is not disallowed.
That to be an issue.
It wouldn't be a contributing factor, but the thing is, everyone wants to blame the gas. So they're looking at anything that they can find in a gas tank.
Yeah.
When I was researching this, I found a really interesting bulletin from the state of Utah, which is not where people are discussing the Medusa stone happening, but the LP Gas Association there put out a memo that said, warning, meth lab, meth manufacturers are using propane tanks to store anhydrous ammonia to disguise it.
Okay.
And so then when those propane tanks go back into circulation, you've got anhydrous ammonia. And that's a really interesting one because, in the same way that you were like, well, methanol wouldn't cause this. When you say, and I'm like, anhydrous, what? Like so many things are happening in that tank, in that valve, outside of the propane. And then I don't even know when you bring propane into that, there's so many things that, very interesting. So any of these touch points where there could be an external contaminant is where we want the problem to be. We don't want the problem to be ourselves, right? But ultimately, what's fascinating about it for me is that if it is the gas, then you would just drain your system of that gas, clean it, and then you'd be fine.
Well, I mean, this highlights,
and that hasn't worked for anyone. They still end up, having it happen with multiple gas suppliers. So it does point back to me to, an inconsistency in their SOP. And what I love about it is that you can't self-report it, because if you knew, you wouldn't do it.
Right.
It's a blind spot that we have.
Yeah.
And so if it's like we see people running, like their systems are running colder than ever before. So you could be de-waxing in your hoses and leaving like a coating of wax inside your hose.
Absolutely.
And if you only ever put cold gas through it, you'll never clean it out, which means that eventually a little bit will clog. And then you put more pressure through and you're just going to like poop a little bit of that wax out into your system. It's like, there's so many of those little pieces that, like, if we were FDA, pharmaceutical quality manufacturers, they know and assume those types of things will happen, and they impose a lot of cleaning and, you know, standardization requirements on you to prevent that from ever happening.
That's exactly what I think about when I hear about all of this, and even the benzene issue too. And this is a common theme of like every time we get together and talk, but it's
Right.
like, okay, this highlights the importance of quality systems in the lab. It highlights the importance of understanding what's expected from GMP, which would include supplier and supply evaluation, like really critical evaluation, and not just like getting a COA from a supplier on your gas and saying, okay, it looks good, but saying like, no, we've actually got to send this gas somewhere else, verify the COA so that we have any reason to believe this piece of paper that someone gave us in the first place. And, you know, and that's just like two little pieces that particularly could have helped the benzene problem.
Right.
But then in relation to this more complicated issue of the Medusa stones, which, like you said, it doesn't take much to interrupt a crystal lattice that's forming.
Right.
And you know,
if you bump that table, I mean, so many things could impact it.
If something's able to just wedge itself between these molecules as they're stacking, then you're going to see exactly what you're describing, where you're removing the solvent out, and all of a sudden these solids start to just crumble. It highlights the type of process validation that really needs to occur in these labs.
Right.
Like, it's not good enough that you've been able to do the same thing and get the same product for a while. Like, you've got to understand why you're getting to your end product and what needs to be controlled throughout the process to ensure that final outcome. And like you said, we have blind spots. And the way that you investigate those blind spots is you have to do your own work to start to manipulate variables, change cleaning schedules, you know, do all these things, good records, which is another part of GMP, just the record traceability of what you're doing so you can actually understand. And it's not just kind of like, I value like the artisanal aspect of labs.
Right.
I love working in labs too, but at a certain point you have to codify, you have to really dial things in, structure them, and not take things for granted. And like clean in place is so important. Understanding.
And people don't do it. People do not clean their extractors.
They avoid it until there's a problem with the batch, and then they go back.
And even then they blame the gas. They don't clean their extractor. You know, they blame the input. You know, people will just drain gas out of a tank and then fill it up with new gas and never open it and clean it with soap and water. But it's like, what makes you think you've removed it? You know, especially if you haven't identified it and named it. So, you know, people have been looking at it, but all they're coming back with is names of potential molecules that could cause it. There's still not enough proof anywhere that says this batch with that molecule has this occur. This batch without that molecule does not. You know, and at the same time, you've got labs that never experience it at all and labs that experience it often. And so, you know, those people are unable to articulate on both sides why people who get the same results every time are not able to prove that they perform the same process at every time. And in fact, I would argue they probably don't. Someone who gets the same outcome every time is probably responding very correctly in real time to a myriad of variables.
And they probably don't even think about it.
No, exactly. Like someone who's good at distillation doesn't follow the SOP because they'll notice if the temperature is ramping up slower because the oil is a little bit thicker. And they'll respond. They'll spin it faster. They'll warm it up a little slower so that they don't start distilling certain compounds before others. Like they'll respond. And in that way, it's not an SOP because they didn't do the same thing every time. They followed a protocol. But, you know, but it wasn't as simple as the SOPs that people write that say, you know, bring it to 180 and collect in a receiving flask.
That's a good comment on how shitty most SOPs are, because if you've got a really good one, it should have enough if-then statements.
It's nothing but if-then statements. Exactly.
That will guide you, that will allow the flexibility. But I think what we have in our industry that's very rampant, and something that
We have like
discourages me a lot as a
recipe
consultant. Yeah,
instead.
exactly.
Yeah.
People are like, I have my book of SOPs I'm going to sell you, and you're going to be able to distill and to do butane extraction and all these things. And the SOPs, I've seen some of them, and they're super, super simple. And it's like following a kitchen recipe more so than explaining how to understand the process and what can go wrong,
Right.
and you know, all of that sort of stuff. And so I agree with you that those types of SOPs, don't allow for any of that adaptation.
Right.
But if
because what they standardize is your physical behaviors and not the product outcome.
Right. We need to make sure you act like a robot.
Right. And that will lead to the same product? Absolutely not. Yeah. In fact, with how diverse cannabis is, if I do exactly the same thing every time, I will only get different final products. You know, if I want the same thing, I do have to adapt. Sometimes you winterize twice. You know, sometimes you don't winterize at all. And if you don't have the flexibility to like check and look and evaluate and pivot, then you take away a lot of your ability to like intentionally succeed, which strangely enough does not follow with actually failing or succeeding. Sometimes you just get away with it in this game. Sometimes you don't. Sometimes your crystals come out great and sometimes you whip them into batter. And so if this was happening 2-3 years ago, before the benzene incident, frankly, if this happened then, people would be blaming the material. Yeah. You know, people would be saying this is something that the growers are spraying, you know?
Right, exactly.
But because we found a problem with gas, now it's going to be gas, you know? And so like, please, by all means, clean your gas, take accountability for it. I don't care what that COA says. Yeah. You touch it and put it in your tank. Now you need a new COA that tells me what's in your tank. They told me what's in that tank, kinda. Right. Tell me what's in your tank, you know? And no one does that, especially because the only people who can give us those tests are the same people who sold it to us. Boo. But if I had that ability, you know, like I have a GCMS in my lab right now. We can test for 59 terpenes. Like I have a mass spec. I've been waiting my whole career to be able to just be like, what is it? And I'll keep waiting because my God, it takes a while. I was about to say the number of questions that I have, like the cool down time in between each one, I'm like, oh, I'm gonna die. But you know, even with all of that technology, I still don't have the ability to really carefully analyze propane because it's so volatile. You know, like it's still more complicated than what I can do. And I'm trying hard and spending money, like hundreds of thousands of dollars money on trying to look at those kinds of aromatics. And I still can't look at my solvent as carefully as I want to. Sucks. It's super frustrating. And so I love the idea of paying closer attention to the solvent. But I do really dislike the idea of disregarding our role in it. Because it is so important. And so for anyone who is experiencing Medusa stones, the SOP to fix it, you know, with adaptation as needed, is to start over with a clean slate, meaning that like you do clean the entirety of your extractor.
And not just run ethanol through your system.
No, like, and that's the thing, like, like run ethanol through it and then run hot water through it, you know, and then run ethanol again and see if that changes, you know, like bring multiple solvents into it. You know, if you want to have a great time cleaning, it really like ethanol and then ethanol water and then simple green and then water again, like you will have the cleanest system. And there's a lot of people out there who would see faster recovery times and faster column drains, faster extractions if they just cleaned their nasty hoses, you know, if they just cleaned all of the piping, you know, like any of that cold metal hard piping is shaking while the fluid is going through it. And that agitation is crystallizing solids out of the solution because it's freezing cold, and those solids are likely fats. Right. You know, they're far more likely to be the fats and lipids, you know, those chalky heavy things than the THCA that's just a little more soluble in your solvent at that temperature. You know, and so that like very strict cleaning process does involve like turning off your chiller and letting things thaw out all the way, heating them up, and then after cleaning it, drying it all the way out again. And once you've done all of that, and I mean all of it, every single hose, weird vacuum hose, clean it. Yeah. Every gasket you own, clean it. Every center disc that you've got, clean, like all of it. You've got to physically wipe it down. You've got to, you've got to verify that it's clean. And if you can drain water out of your solvent tank and then drink it and feel good about it,
yeah,
go ahead and pull that thing under vacuum and add new verified clean gas back to the system and try again.
Yeah.
And while you're at it, write down what day it is, what time it is, and all those weird cleaning things that you did so that you can repeat it or improve upon it next time. And that will fix it until
it happens again.
You do the thing that caused it the first time. And, and people don't like it when I blame them as the operator, but this is the accountability that I feel we have to have. If a grower grows shitty weed, if they don't control their environment, so they get pests, if they do spray pesticides, if they do hire someone who brings in their own, like powdery mildew issues. If a grower does any of those things, some of them are that grower's direct fault, and some of them are indirectly that grower's fault. But in any case, we blame that grower.
The responsibility.
They grew bad weed. And so I strongly believe that as soon as you own that product and you start touching it and you start extracting it, it is 100% your fault from that point forward, whether you succeed or fail. And sometimes you aren't in control of that, and it is still your fault. The fact that you couldn't be or were not in control is your, responsibility there.
For the outputs of that lab.
Right. And so nobody wants to hear that like they didn't clean well enough and so it'll keep happening, but like prove that you did clean well enough. And we can talk about it. And so, it could be caused by these trace contaminants in the gas. It could be caused by trace contaminants accumulating in your system. It could be caused by something weird that no one is admitting to or talking about. There are so many variables at play, and I love that people are paying attention to them now. I love that, like we do finally have the type of quality of cannabis concentrates where a physical characteristic can be identifiably useful, because when we were just making like earwax and stuff, or even look at distillate, like I can't put that under a microscope and figure out what I am dealing with as easily as I could, with like looking at, a bud and seeing intact trichomes or not, So like, in terms of identifying quality, it is really cool to be at this like crystalline level where we can make extremely pure products. But all it should do is remind everyone that we have always been making products full of Medusa stones.
Yeah.
Like forever. We just never did a good enough job in the past to have a repeatable product outcome like a crystalline THCA diamond.
Well, and most of the prior extracts are highly heterogeneous products in the first place in terms of like chemistry. So you would never really think about it. And so it's just, things have gotten to the point now where you're so focused on purity that now new qualities are emerging that you got to pay attention to and notice.
Yeah. And it's fascinating because the people who this happens to, I think would probably tell you that they're not focused on purity. They're the kind of people who would tell you like, it's about that full spectrum and all those other ingredients. But at the same time, I'm like, well, out of respect to all of those other ingredients, you're going to have to compromise sometimes on the appearance, on that outcome, and like, that's something that I think the rosin community does a better job of, where they're just willing to say like, sometimes it doesn't work out, even if the weed is good.
Yeah.
And we're just going to pay more for when it does because we value those qualities.
Yeah.
The race to the bottom doesn't serve you if you want diverse inputs and identical outputs. That's hard. It's a tough problem to solve. It's exciting. Like I love that people are paying attention to it. I love that people care because, like I said, there generally are the people that, they aren't doing that type of, high intensity chemistry in the first place, because they do appreciate the full spectrum value. But it does show up, like I hear people talk about melting down their CBD now and commenting on if it changes colors when they melt it down. And like, these are still people who wouldn't consider themselves chemists, but I'm like, you are so close to like just caring about chemistry and embracing it.
Yeah.
You know what I mean?
Because
like, like we're so close to like the really fun part of the conversation. And it just sucks that, it tends to come out in this sort of, circular blaming scenario where someone has to be at fault in a negative sense.
Right. Rather than just let's work together, figure this out, and move forward.
Right. Because I've been a proponent all along of like, whatever the issue is, soap and water will fix it, and that's like a generalist term. But, the idea is that if it was weed that caused it, or it was gas that caused it, clean your system and start over with new weed and new gas, and you can move forward. And then let's continue to spend so much time and energy figuring out what that weird thing is over here. But I don't see people testing that Medusa stone. I haven't had anyone say this is in the thing that's crashing. They're all looking to a solvent mechanism, which, does make sense because it would affect the crystallization. But the idea of like a teeny tiny amount of like a weird amino acid versus like a 45-degree temperature swing between your first run of the day and the last one.
Right.
Like, I don't know, like some of these are more important than others, but only a few of them are being tracked. So it's a cool thing to watch us kind of like stumble in these rudimentary ways when we're at the top of our game. Like the best people, the highest volume processors, the people with, the biggest staffs and, multiple extractors and huge processing contracts, that's the people it's happening to. And I love that, because unless it happens to them, we never get any of this data. That's how it gets funded.
Yeah, no, absolutely. And how it draws all of that attention. I mean, I feel like a year from now, we'll probably have a much better understanding of the variables influencing that. And I agree that if I don't know a ton about this, I do some extraction, but that's not the world that I'm heavily involved in. And so, but just thinking about all these variables and chemistry and everything, it does seem to me that it would be likely that there are multiple things leading to the same end result, that it's probably...
I mean, if you want to think about it in like, because you come from analytical chemistry. So I would say that the extraction that you do in analytical chemistry is the most appropriate for this exact type of problem, right? Hold on, dab real quick.
Yeah, no worries.
But with analytical chemistry, like think about sample prep, right?
Right.
So many solvents are likely acceptable for a given sample prep and a given column and, whatever other, factors you're going to consider in your method. But there will be one or two that are the best for that particular sample.
That application.
And the way that we figure that out is by doing all of the other ones also.
Yep.
Like you figure out if you want a methanol prep or an isopropyl prep or a water prep.
Validation. When
exactly.
to figure out what to do.
Exactly. And so when I say, so when I say we don't have SOPs, I mean that we have not validated our method, because we do have, actions that we take. We have behaviors that are repeated, but we don't have proof that those behaviors lead to those outcomes.
Yeah.
And so the extraction in the analytical world, if you're trying to break it down from many compounds to one, you have to start with all of the extraction options on the many. And then for each one, you extract it again, all those times. And you keep doing that until the pattern shows you that with these solvents, these compounds are concentrated. And with these solvents, these compounds are concentrated. And with these solvents, crazy shit happens, destruction happens, data is lost, like there's all these directions it can go. And the only way that you ever trust that these ones that worked well actually work well is by having proof of failure.
Yeah.
Like we figure out the boiling point by burning it. You know what I mean? Like we have to go beyond it to make sure
to know where it is.
that was just the boiling. So like you have to fail.
Yeah.
You have to fail on purpose.
It reminds me of validating analytical methods for infused products and edibles and stuff. Because back in the day when we were first wrestling with that, it was like, okay, we're going to take this brownie or gummy or whatever and prepare it in all these different ways. And you see your terrible extraction efficiency with certain methods, and then you see it get better or worse, and you're like, okay, I now know which method is giving me the best extraction efficiency. So we're going to like move towards that direction, manipulate more variables, do it again in a series, try to see how we can get that boosted up even more and even more. And that's how you start to learn about, all of these little kind of tricks that you do in sample prep to get your separations the right way and to get the cannabinoids to move into a certain fraction of these liquid extractions and things. And so, I can see a lot of parallels there. And I agree. I think there's a big validation problem across the board with all cannabis production in general. It's like we've gotten to the point where we've got a lot of processes that quote unquote work. And it would be nice to see, I would love to see a cool, peer-reviewed study that just took all of the common methods, even if you just focused on like butane extraction, there's all sorts of setups and different processes just in that system, and just compare them, just like literally, that has not been published. Like there is not such a.
I'll tell you what, a friend of mine works in the cannabis industry as an extractor, and he also produces his own music, and it's got terps. If you guys want to check him out on Spotify, on Instagram.
Nice.
But he released a song called C4H10. Okay.
Nice. Yeah.
And like the bridge might not be the correct word. I don't do music, you guys. But like it talks about like the consistencies, and like if it's too dark, it got too hot, run it, like, and just like all of these different, like, like if it looks like this, then it wasn't this, and like run it colder, run it faster, keep, like all of these like instructions. Nice. And I'm like, you know what? I think like between TikTok and like, you know what I mean? Cause like the way that you found out that good weed was sticky, that was rap. Rap taught me that. Okay. No,
that's true.
Plant scientist in my life ever explained to me that trichomes are resin and that resin is sticky. If someone would have explained it to me like sap on a tree, I would have understood it much sooner. But instead, I was under the impression that good weed is sticky icky. Like that's the place that I sourced it. And so, we got to meet people where they are. And I think the age of like, when the peer-reviewed journal really had its impact is when we didn't have the internet. So like for data to be written at all, we took a little more seriously, because we respected it as having the impact of truth, whether it was or not, right? Like that's the point of peer reviewing it. That's the point of fact checking it. That's the point of like traditional journalism. Traditional journalism is gone. And, the new method of information transfer is information overload.
Exactly. Just get it to people as fast as possible.
Right. And so it's like almost the more citations you have in your paper, the less valid it is. It's almost like it's too much information, because now I have all these points to pick at and pull apart, and and so I think that there is this like peer-reviewed nature of like consumer standards that we can establish. And I think it's maybe pop culture is how we do it, going back to that social consumption thing. I think that maybe that's how we figure out like what's cool or not, because we do that to ourselves with alcohol, right? Where like, we know that if you're drinking vodka Red Bull, that is a different thing than a glass of Merlot, and we judge each other accordingly, and we like the social construct is there. And even if you don't understand that it's because that sugar is so dehydrating, which makes that alcohol cause more brain damage by volume than the other one, like you don't need to understand all of that. But if you did, then then the social niceties, would have come naturally to you. And so it's like, we do have that potential to communicate it. It's just so hard when the people who want it the most sound like us, because then everyone's like, well, of course you could do all of this, you scientists, and you get like, people don't want to associate themselves as the scientists, but we all are. Yeah. Everybody cares about science. Everybody does science. Everybody interacts with it.
The first thing I teach in my workshops is everyone is a scientist, and especially kids. And it's a matter of how you think, not what profession you have or anything like that. And I like the idea of a cultural push for a different type of like peer review, like an industry. And there's some groups that have tried to do some stuff like this, that have tried to do more or less like casual research, kind of pop culture focused kind of quote unquote research that's not going through traditional scientific journals, but it's being treated in a similar fashion, that there are industry quote unquote experts, which I always hate using that word, but that are reviewing this stuff and trying to provide input and get that information distilled. And so I think that can take many forms. I love the idea of that form being music. As a musician myself, I'm like, I definitely am going to go check out.
Yeah, I'm going to send you these songs because you'll love them. He's got a bunch. But I love how low key it is, because it's just like a good beat, and if you just like dab, then you just be like, yeah, got it too hot, get it cold. Well, you're just like, of course, this sounds great. You don't have to know the chemistry, but if you do, and you hear that, you're like, this is an SOP. This has more details in it than most SOPs, and you can have that for free.
I've thought about even for the podcast, creating a side channel or something. I've wanted to do this for a while because I do it for myself when I'm editing, where I'll take clips from episodes and then put music behind it. And just, it takes on a different quality because you kind of get into this groove while you're listening to people talk, and it just kind of hits differently. And it's something like I'll pull up lectures from people and then find good like chill hop beats or something on the side and run.
It changes it completely.
It completely changes it. Yeah. And so
think about a movie, like the soundtrack is the entire tone. And I think that's the problem, right? Is our tone has, like when people hear me talk about cleaning their extractor, they're like, Murphy is yelling at me again. Like it doesn't sound supportive, even though in my heart, I'm like, I will come help you, clean this extractor. Like I would love to see how much weird stuff comes out of it. It's gross, but it's fascinating. Like the scientist in me is so about the data that I tend to steamroll the way people feel about it. And, and I forget that there's like this. I forget that there's that detachment. And that's why I think for the consumer to tell us what they want will probably require art. It will probably require that medium of, like what their language and their communication,
connection.
Yeah. Because it's working for food. You see that organic produce. You see this like hype around a farmer's market. Bookstores are coming back. People are willing to, like communicate their, what's important to them, their standards and their morals, their ethics. And like, the younger generations, I think are more keenly aware of their power as consumers than we have been in the past. Because all of us from the legacy market would like buy whatever weed you had at whatever gas station you told us to drive to and meet you at. Like we didn't like, oh, you're not available till 10:45 p.m. I guess I will see you then, like it just didn't, oh, it's $20 more than last time. Here's my $20.
Exactly.
We aren't used to having that power. And we are used to apologizing and hiding and protecting ourselves. I think the next generation is going to approach it differently, like they have with every other, social issue. And I'm really excited for that because as scientists, like, there's an expert in everything. Not everything is of, impact to people. So
Yeah,
like, if you don't tell us what to look at, we will look, like once you get out the microscope, like you can miss big things.
Right.
And so like, we need that direction from people. And I think that, like it'll be more than like peer review. It'll be like the impacted review, it'll be like, because that's what it does come down to is, like the people who care the most about the environment are criticized by the people who say, well, you don't understand that all of the things we provided for you rely on this. And they're like, well, do it better. Like start over there, they're like, well, like, cause they're sitting there saying, no, we're on the impacted end.
Mm-hmm.
And, in that position, they have all the motivation in the world to start over at the beginning. Nobody who has already built something is excited to start over. That's why people need pesticides and, spray fungicides, because if you did just empty your room and clean it every time, you'd be able to fix it in one round. But no one ever takes down their grow room and completely cleans it. And the people who do can tell you the difference.
Yeah.
Same thing goes in the lab. And the only reason that anyone's going to require it of each other is if the consumer demands it, because we're here and the government is not asking for it. And if they start asking for it tomorrow, you're going to lose even more of us.
Yeah. Yeah, absolutely. Yeah. Well,
then you'll really only have the corporate mids weed, because it's clean.
Yeah. Has more and more of that.
They have the money for GMP. Yeah.
Well, and this connects to one of the last things I wanted to make sure to talk to you about, because the last time you were on the podcast, I think Hash Fight was just starting as an idea. And so one thing I wanted to ask you, because you've been able to do a couple of projects now through that at least that have been publicly available that we've seen. I wanted to find out what are some things that you've learned from that experience of doing Hash Fight and trying to encourage people to step up and examine things and share data, and that sort of thing. How's that experience been going? And what's been your takeaway so far?
Experience is the right word for it, for sure. So I'm not involved in Hash Fight anymore right now, which is, I think like the thing I've learned the most about throughout that experience is that, business is business. And science is so much more fun when it isn't business. Being able to separate those two is your best case scenario and hard to pull off. The experience of Hash Fight itself, incredible. People want that data. They're obsessed with that data. They don't know how to interpret it. And so it is 100% about delivery. Like, if I write a PDF and it is paragraphs of language, no one is reading it. If I close caption over my face saying those exact same words, 10,000 views, so it is 100% about the way that we're communicating. And in that case, not even the words, it's just the fact that it's me talking and a little bit of a beat in the background. It's everything. It changes it. And so what's great is that like the consumer does care. People do care a lot. They just don't know when or why they should be concerned. And so like they just kind of associate things as good or bad. And sometimes that's in a general sense, and sometimes that's good or bad for them, and it just depends, So you'll hear people say, I only smoke solventless because it's pure. And you'll hear people say, I only smoke solventless because I have asthma and I've had live resin that irritated my asthma. And like both of them are taking the same action for what they understand to be different reasons, but they are actually both the same reason, which is that there's a different terpene profile and a lower ratio of those terpenes overall compared to a more concentrated version. And for potentially obvious, but so far unstudied reasons, like it makes sense that, they would have different experience. So being able to bridge the gap between like me saying, oh yeah, the terpene number is completely different and the other volatiles are completely different, and them saying it hurts my throat a little bit when I dab is huge. And what's even more important is that when they say it hurts my throat a little bit when I dab, none of that means that the solvent extraction method is responsible for their throat hurting. Yeah. That's all still about the terpene concentration, you know? And so the exciting part of Hash Fight is like, we have both problems. You know, we have, how do we make a product better? How do we make it more economical? And then we have, how does that impact the people who consume it? You know, and, or does it, right? And so what I loved about, you know, some of these experiments is that like people will tell you what they want. So when I go into it, I'm thinking I want to compare two pieces of equipment that are really similar, right, because those differences would be exciting to me.
Right.
And everyone else is like, shiny metal is shiny metal. They want to see a bicycle race a car. They don't want to see two cars race each other because they're like, yeah, it's a race car. It's fast.
Right.
You know, like that's not impressive to them. Yeah, exactly. Yeah. But I'm up there like, ooh, get my caliper. Like, let's figure out what's going on here, you know? And so, you know, for the consumer to just like remind us constantly that like, no, why do I care? You know, like, oh, you think this about this, why do I care? Yeah. And I love that because they don't treat like a dispensary Instagram page that way. You know, they don't treat like there's all these cannabis education companies out there, you know, and you kind of end up, I'm sure you probably experience this even with your own Instagram, where like the people who interact with you the most know what you're talking about.
Yeah.
So like, that's great. It's appreciate, love the support, but like I'm trying to teach somebody and you already know. So like, can you tell someone like, how do we get this further out? Right. Or you end up in an echo chamber. Yeah. And then you can't break that wall.
What I've run into that I've struggled to navigate lately is sometimes people that are very knowledgeable are attracted to my stuff, which is great, but then they want to have debates on tiny details. Kind of like what you're talking about, that I actually do find very interesting, and I want to have those conversations and debates, but those conversations are not at a level that most other people watching the conversation happen that they're ready for or can really contextualize.
Right.
And the biggest one that has been so hilarious and frustrating at the same time is this debate that happened on my Instagram recently. I woke up and had 76 missed messages or comments, and it was a whole debate thread about whether to use the word strain, cultivar, or cultivar.
Oh my goodness. Yeah.
And you know, and it's like that's a
like y'all learned about Brax like 2 months ago, okay? So like calm out, everybody. Yeah.
Well, and it's the folks talking on there, they were very knowledgeable and had a lot of understanding about how the nomenclature of cultivated plants works and everything like that. But it's like these posts are not really designed for that audience. Right. It's more designed for like the layperson who's never even thought about this before at all, and to get those gears turning.
Yeah.
And so when you start to have a debate over the very technical definitions of these terms by different institutions versus sort of broad philosophical understandings of how these words are used, people just get lost and their eyes glaze over, or they go the wrong direction and like misinterpret things. And
and what they want to say to you is, why do I care? Why do I care if it's a strain or not? Right. And they're not going to interrupt these smart people saying that. You know, like there's no place for me to say, okay, but do I get high differently if the strain / cultivar / chemotype / terpene content is different? Right. And those same smart people will, like you just said, they'll say, I don't know.
Yeah.
And so I'm like, well, now what was this for? I could have just watched a funny dog video, you know, and been way less stressed out. Like now I need weed because I don't understand what just happened. So, you know, that consumer doesn't usually have a forum to ask the real question that they have. You know, like we all sit there and say, like, ask us questions. But if people are afraid that their question is dumb, or if they have never been given a context where that question would have the right words, you know, then it gets really hard, you know, like if you just have a word that's difficult to pronounce, people are going to do everything they can to not use it, you know? And so, we really shut people out. And that's where I do think there is something to the, like the spoken word, the music, the art aspect of it. We've got to let people bring it to us nerds in not a graph, not a citation, not a number. We will convert it. We can't help it, but I'll do that if you paint a picture of a rainbow. I'm already sitting there thinking like magenta versus, you know, like I'm just categorizing. And so I don't need to put that burden on other people. Give it to me the way that you've got it. And I would love to pick it apart and figure out what you mean. And that I think has been the best part of those experiments, is that like people really, when you get high together, when you smoke the product with them, it allows them to ask those, you know, those real like impact questions about like, why do I care about the outcome of this experiment? Because the reason I'm doing it is for them, but it's not, you know, because that's me parenting them. That's me saying, I know what's better for you than you. And that's not true. You know, what I need to be able to do is say, here are data points that do matter a lot, and make your choice, you know, and meet them there. You know, it's just as much my responsibility to make sure people understand as it is to put the data out. You know, like my responsibility doesn't end by a post, and it also isn't easy to have in a comment section. No, exactly. You know, so
I've even considered turning comments off, because it's I've found that almost always there's not a productive element to the dialogue that happens in the comments. Like sometimes people make interesting points, but it almost always derails into, you know, even when people are fighting for their points, there's these subtle jabs that start to come in. It like starts off like soft, where there are little comments that are disrespectful and everything, and then it starts to snowball, and you're like, none of this was helpful at all to anyone that is new trying to understand these concepts. And I don't know, I like that our conversation today has started to like really circle around this idea of communication, and how to find out what consumers are wanting to understand when they can't ask the questions themselves, whether they don't know the question or they're uncomfortable. Because I think social media does present that problem where, okay, you ask a question, but someone's going to come around and call you an idiot for asking that question. And I can't stop them. You know, if I see it, I can delete a comment, but the impact is already made, or that person feels shut down.
And more importantly, the 10 people who saw that happen that now won't ask an even better question. You know, like it's a huge problem with the echo chamber. Like you just end up, you know, like in microscope land, where you're just looking at like this one little piece. And, you know, the fact is, like, none of us in those comment threads are the ones supporting your brand. None of us are the ones that are paying full price at the store for those grams. None of us are the ones that are working the average minimum salary wage, you know, as a bud tender. You know, like, we are just not that demographic, and we're ignoring them.
No, I agree. It's something
not on purpose. We stand around and say, we're here for you. Come and ask me questions. We're just terrifying, you know, or rude, you know,
it's just I mean, it's something I try to figure out, because like workshops are nice, because then you've got people in front of you in a smaller, intimate group setting, and they tend to communicate more. But then that's hard, because then you've got to actually get people into that setting. And I've played around with like free webinars and stuff, but then that backfires in a certain way. And so it's tricky to figure out how to create, you know, sort of the safe space for people to ask questions and explore ideas.
I have an idea, though. I have an idea. This is my suggestion for everyone, is that if you make cannabis products, you should consume them with the people you sell them to. Like every other industry spends most of their budget on marketing and focus groups, like as much as they spend on manufacturing. We don't, and we haven't supported an infrastructure that really creates it. But I'll tell you what, if you have to stand there and give dabs to people who don't like you or your product, you will learn everything you need to know.
Yeah.
in the way that they cough, in the way that they don't come back for another one, and the way they tell their friend they didn't like it, you will see exactly why your sales are down in 5 seconds. There is no better source to get that information than by directly consuming with people. And in an environment where we're all smoking a little bit of weed, I think it's possible that we could leave a little bit of the ego aside and be a little bit less confrontational in those questions, because asking stupid questions while high is totally allowed. Everyone knows that,
Right.
Absolutely.
That's a really good point, I think. I mean, it's like, okay, if the question comes out completely ridiculous, everyone just
you're just
smiles,
like, oh,
laughs,
I'm
and moves
high.
on.
Whoops. Yeah, it's fine.
Exactly.
So it
No
allows
judgment anymore.
a safe space. Yeah, I think that the social consumption is like the next best tool and research area that we've got, because what we have done is smoke weed by ourselves, grow weed by ourselves, extract weed by ourselves,
hide it
hide it from everyone. Wrap it in 100 layers of plastic, and ship it as far away from yourself as you can before you get paid for it. And so if we, when people talk about being single source, when we think about the food, cycle of going farm to table, it's easy to apply that to a grower, but if you're manufacturing goods and you're not out there seeing what it looks like when people consume them, you are missing a huge piece of the puzzle. And whether that is a piece that you need to react to on the manufacturing side to produce it differently or make it differently, or if it's just telling you that you've been marketing it to the wrong audience.
Right. Yeah.
Get that data, get it.
Yeah. And don't just rely on contracted salespeople to tell you that stuff too. I think that's another trap that companies fall into, is they're like, well, I have my sales team that goes out and is managing accounts and blah, blah, blah. But no one will care more than you if you're, behind that product. If you're, you own the company or you run the lab, you're or whatever, no one's going to care more than you.
Exactly. And no one has a more honest opinion than someone who paid full price.
Yes.
So that's who I want to hear from, not the person who got it for free and said, yeah, it was great. Because what am I going to say? It was free.
It was free.
Yeah.
It worked.
In terms of value, good enough,
Yeah.
So I think that is really the next big change for everybody in the way that we collect data, in the way that we use it, in the type of data that we start to pay attention to. We could have a better vape cart delivery mechanism that doesn't inherently include heavy metals if we wanted it. But when I say we, I don't mean you, Jason, and me, Murphy. I mean all of the people who are like in the span of this interview, there's probably been 100,000 vape cartridges sold in America, and those people need to want it,
right?
And if they don't,
it's tricky.
What you and I say does not matter. Not going to happen.
Yeah. I mean, I've now that I've moved back across the country from Oregon, I have a lot of friends that have shown me different cartridges and things that they've gotten from God knows where. And it is unsettling to see what's accepted in places that have not chosen to regulate cannabis in much any way at all. Because consumers in these areas are still in that sort of mindset of, I'm happy with what I can get. And they don't know that what is being given to them is potentially extremely dangerous. I mean, some of the things that I've seen in vape pens in the Southeast, I'm like, that looks like stuff I might would have seen 7 years ago that, is well established that we should not be ingesting.
Right.
Or it's stuff that it's I'm pretty sure this might have vitamin E in it or something, because
I found a recipe online for vitamin E acetate vape pens that someone wrote in good faith and was like, this is a great diluent. It's food safe.
Right. And you can add
They
flavorings.
said.
It'll taste good.
Yeah.
They won't cough. It'll be fine. And, once I explain
Yeah.
to people, once I'm like sitting in a session with somebody, and I'm like, the reason you're not coughing is because stuff is like
because
coating
you're
and
not breathing
immobilizing.
either. Yeah, it's actually it's degenerative. You're gonna stop coughing forever one day. Yeah, it's not good. But that's where like the consumer does care but doesn't know how to ask, and we can get to them if we, instead of trying to get to them, go to them.
Well, and that's
what I mean?
My point is like the most, because all of my friends that know me in the Southeast, like they've known about my work in the cannabis industry for a long time. They don't know, a lot of them are not so dialed in exactly what I've been doing, but they're, they know that I'm a resource there that they could come to at any time.
Yeah.
But these issues never came up until I sat down with them, and they're like, hey, check this out. And so I think there's a lot of weight to that, of trying to meet the consumer where they're at. And I love that our conversation just came around completely full circle. These are important points. And like I said in the beginning, those of us that have kind of been in this industry for a while and have watched so much transpire, I mean, this is kind of where my head's at now. Is I'm like, how a lot of the simple stuff has been figured out.
Yep.
How do we reach people and get them to care, get them to engage? From my own perspective, with Curious About Cannabis, I'm thinking about, now that I've gotten through my move and I've got a lot more bandwidth now, I'm like, how can I change what I'm doing to actually click with people better? Because there's an obvious gap that I've recognized.
Yeah.
And I'm in the process over the next several months, like totally changing how Curious About Cannabis is structured, because I'm like, I've got to do something different, because I'm mostly reaching people that are already scientists that find what I'm talking about as interesting, that they want to listen to and stuff. But I'm like,
it's just people trying to make friends. We're just in your classes to network. Yeah.
And it's like, that's not actually going to like help very many people. And then when
those people aren't curious about cannabis, they're passionate about cannabis. The curious people are like afraid to type it in Google still a little bit. You know what I mean? Like the curious people like drive past dispensaries every day.
Yes.
And are like, wouldn't know what to do when they walk in and there's 2 doors, and they'd be like, oh, whoops, I'm going to Subway. They just, like those are the curious people we got to catch.
And the only time that I seem to catch them is when I'm in front of them. And so, it's an interesting challenge put forth to those of us that are trying to educate. We've got expertise, we've got a lot to share and a lot of ways to help people, but we have to find better ways to connect with the people that can most benefit from all of that knowledge and experience. Still have a long way to go, and some of that's law related too, in terms of, in some states, it's a lot easier to get in front of people and be, handling products and, more interactive in that way. And others, you can only talk kind of hypothetically, and, so there's still some of those constraints, but I think there's a lot of opportunity. I also am not surprised to hear you say about Hash Fight that the separation between science and business is important, because I've run into my own experiences in that way. And it's can be very challenging to mix those two, and a lot of people are not ready for that.
It's what I love about science is the fact that kind of engaging in it is an agreement between all parties to respect verifiable data. Even when we hate each other, we're like, okay, but 4 is 4.
Right. We can at least agree on that.
And we have, there is always, something that, brings us together in it. And that's the part that I am just still 1,000% head first on, is in spite of how difficult it can be, in the cannabis industry to get people to care about the things you care about, let alone, fund or participate in or even support the things you care about. There is just still so much opportunity, and a lot of it, I think, is easier than we've allowed ourselves to believe, because we're used to asking for the right to smoke, for the right to access it. We're used to asking for the right to not go to jail for it. And so we feel like we have gotten a lot of what we wanted, but that's because what we wanted was pedestrian. In the year of 2022, we can have so much more than that. If we just start, saying that we want more than that and communicating it and finding the people, who agree with us. And there's always a creative solution forward, I think, for that. And with cannabis, I think it is pretty exciting that even though there are states without the legalization yet, I do still believe that the social consumption is the key to those areas. Because the only reason that a state hasn't legalized it yet today in 2022 is because the people who support it are afraid that their friends will find out. And if we can get rid of that,
the stigma,
the same number of people support it everywhere. The same number of people are smoking weed everywhere. The same number of people could be smoking weed if it was legalized where they're at. The market isn't actually different in a lot of those different areas. They just care a lot more about what their neighbors think.
Yes.
And they haven't been told that they're allowed to get high yet. They haven't been told that it's something that they can do.
It's not socially acceptable. For them. It's not political suicide to do.
Right. That it's safe, that it's fun, that it's an alternative. I feel like that basic message we got really far away from when we complicated and purified and tested and regulated cannabis. And it's a fun thing to come back to, especially to come back to it in the spirit of recreational, because medical cannabis is so important and it is capable of so much, because natural product medicine is capable of so much. But that is also a really hard place to exist all the time. Only dealing with chronic cancer patients was the hardest part of any part of my cannabis career. Like my first patients were the medical patients, and like that impact is everlasting. And I don't know that I'd be able to do that every day the way that I can introduce someone to how to dab at a lower temperature. And suddenly now you have someone who can enjoy cannabis concentrates, I love that kind of impact for my own mental health, and it keeps me motivated to go backwards to the medical and say here's all these problems we can solve. I think there's so much still out there in just the people who haven't smoked weed yet that are going to bring up some real obvious questions.
Right. They're like, well,
that we have not thought about yet.
Yep.
And I can't wait.
Yeah. Well, I tell my students in workshops, I'm like, obviously the workshops we're exploring all these ideas and everything, but like the dialogue that you bring to this is so valuable to everyone, including me as the educator, because the questions you ask are going to help me see everything that I see all the time through a slightly different perspective. And I need that. I need to be able to, put different hats on and understand how people are viewing all these things. And then it makes other questions more obvious once I can dial into that.
Sometimes I'm explaining it wrong. And the only way that I find that out is when someone asks me a question that demonstrates that they don't understand. And that's not them being dumb. That's me being dumb and explaining it poorly the first time. And what a great thing to get past
giving
that.
You an opportunity to refine and say, okay, there's a different way I can probably say this that's more in line with what I'm actually trying to get into your head.
That communication part is real. We don't need to keep talking at people necessarily. I don't think that more labels on the packaging is really making a big difference for anybody in terms of their health and safety. I think that the 5 minutes that they spend talking to a bud tender has probably even less impact than we think it does, because that's a retail transaction. And I'll tell you what, if I was in a line waiting and now I'm waiting, like, I'm not asking about mortgage rates in line at the bank. If no one's there and it's the middle of the day and I see a sign, I might bring it up. But like Friday afternoon, absolutely not. I am not that person.
Yeah.
So same thing with cannabis, you know, like we keep trying to focus on these touch points that we have a lot of control over, like the package, like the bud tender, like the dispensary, like the signage. But really, I think what we got to do is we got to smoke weed with people. We got to let them use that product and tell us about it. And, you know, be very, very literal in their experience. It's the thing we've left out of all of it. You know, it's been all about when we touched it and where we put it and how we packaged it. And we just completely ignore the fact that, like, it's still hard to buy a bong. You know, it's still weird. You know what I mean? Like, weird stuff is going on out there that, you know, we don't always have to address.
A lot of people still feel like, you know, like doing dabs is like, you know, doing some hard drug or something because of just the aesthetics of it. If they're not,
and if they complained more, I promise you, we'd have a better device, immediately. But because they just don't buy dabs, we don't get to have cooler dabbing devices. Okay. I don't want to use a weird torch either. This is inconvenient for me. I would love something that's easier to do. You know, but yeah, people are going to get what they ask for, and we just got to give them that opportunity to ask us for, you know, better stuff. Because right now they just know how to ask for a discount. That's about as much as they're willing to negotiate. And so we can change that. I'm excited for that.
Like you said, just getting them in the door sometimes is a huge win, considering all of the stigma that's still floating around out there. And I do think that those of us that, I mean, I don't live in Oregon anymore, but spent 10 years there. All of us that have grown up on the West Coast, in Colorado, in these markets, I think we very much underestimate how impactful that stigma still is all over, because we just get desensitized to it. And I think it's hard for us to imagine what it's like to be a new consumer today, like you mentioned, compared to, you know, when we started consuming, when none of this existed. And so we have to be humble and recognize our own deficiencies. And I mean, it's not good or bad. It's just like one of these things, like you just can't. The only way you're going to get into that mindset is by talking and interacting with those people, because it's going to be impossible for you to do so otherwise, because that's not the situation you came into. It's not the situation, you know, it's not where your head's at now. So, yeah, I totally dig all of that. I'm about to check and see where our time's at, because I totally lost track. Yes, it's gone way longer than I.
Oh, no worries.
I haven't done a long episode in a while, so this is nice.
I always talk for too long, I think, but I
these are really good points. I mean, we've covered a lot from, you know, talking about public consumption and how that leads to questions that we're going to ask, and how that public consumption piece can assist the communication piece and the understanding, empathy there, so that producers can do a better job, so that dispensaries can do a better job, so that scientists can do a better job communicating. You know, these are all critically important topics. So I'm glad that we covered them all. And I hope that everyone listening has found this valuable. I hope that everyone listening is enjoying another long format podcast, because it really has been probably a year since I've done an episode that goes over an hour. I used to do them all the time when we first started out. 2-hour podcasts would be pretty common, 3 hours even.
So. Yeah, I'm talking to someone about starting my own podcast, and he says, you're going to want it to be at least 30, 45 minutes. I was like, I don't know how you're going to edit it down to that. You know, I can't do an Instagram live that's shorter than 30 minutes, you know, like I don't know how.
I can't do the, like, you know, just basic Instagram stories. I try to like start talking, and I'm like, oh no, this has turned into like 10 little, you know, chunks that I don't know if anyone's going to actually sit through.
I need my verbal words to have like hyperlinks so that you can like reference what I like. By the way, if this, because of this, there's too much nuance, but it's really fun. I think like the podcast format is a huge help in this industry. I see it in the mycology world as well right now, that like the long form conversation is coming around, and I think that, we do still end up with the same echo chamber potential issues, but it shows me that like, there is this big gap between people who just need a little bit of information and people who, when they care, want all of it, and I'm great with it. Whichever piece you need, I've got an Instagram or a Curious About Cannabis episode to get you through it,
That's how I feel about it. I'm like, between the podcasts and everything else, the Discord, the books, I mean, geez, that's kind of how I've been tackling it, is like, there's got to be some medium here that you're going to resonate with. And the podcast, for me as a listener, which granted, since I've been making podcasts, my listening to other podcasts has gone way down because I have no time. But when I used to listen to podcasts all the time, it's a sense of like being in the room, sitting at the table, being in the conversation, being that silent other that's sitting there, listening to folks talk about stuff they're passionate about and absorbing what you can out of that.
Yeah, it's like an automated Google search for me when I hear a good conversation, because as soon as someone says something, I'm thinking about the questions I have about that. And then the next person asks them and I'm like, whoo, now we're going, and then like someone, and then someone asks a question and I'm like, oh, I misunderstood that other thing. And I figure that out based on their question. And I just wouldn't get that
if it's just a
reading alone. Exactly. I'm never going to get that from a PDF the way I can get it from a dialogue, which is just so valuable, especially, when I'm thinking about things that I don't understand at all. When we're talking about even just hearing people pronounce some of these words out loud. Thank you. Thank you for doing a podcast and saying that word.
Right.
Probably practicing it beforehand, because I still can't, you know what I mean? I'm still working on it, but I love it. I do love this medium for it. And I think that, the way that we get the other 90% of people is definitely probably in those little one-on-one snippets, a passing joint at a, outdoor barbecue, and just like one at a time, just pick them off.
And it spreads, it trickles out, it cascades. Well, I'm excited to see if you do put together a podcast. I think that would be a really fun one, especially if you do not make it 30 minutes to 45 minutes. I mean, I know there's a whole world of podcast listeners out there that love that, but I definitely think, I don't know, personally, having done, this is like our third episode and we've done workshops together and stuff, knowing you the bit that I do, I would want to hear more of a long form. Although I could see, depending on the topics that you hit, and if you have someone to edit for you, because you can get
it would be the editor. Someone would have to cut me up and shut me up, or else it would not be short.
They made like little summary sort of reels that entice people. That's something I wish I had the time and energy to do, is to take every episode and make like a 5 minute, 3 minute,
get the pieces,
just like the pieces there, so that people have a sense of what's in the conversation. I think something like that would be extremely valuable. And that's how I wanted to close out. I wanted to ask what's on your horizons and kind of what you're kind of leaning into going forward. And
I mean, I've been leaning hard into analytics, especially since we last spoke. I mean, I've got an HPLC and a GCMS in the lab, so we're testing for potency, for terpenes, for solvents, for just like whatever I'm patient enough to prep and wait on, and that's been fantastic and extremely distracting. Because it just comes with so many questions. And so my next couple of projects are still all around analytics. And some of that is, like standardizing product formulation on vape pens, so that even with the cannabis derived terpenes, we can get a pretty well mirrored profile, on all of these outgoing batches. Some of that is like research projects to demonstrate the value of live resin over like a distillate plus terpene profile. And that just comes at looking at other categories. So there's a lot of that I'm really paying close attention to with like Sano Gardens and with the live resin, products that we're making, because, making hash is the day job. That's the stuff that I love. But then separately, I've got another HPLC coming, so that I can start playing with mushrooms, because swapping columns is so much more than those two words. And no, thank you. So, so that'll be a second HPLC, it turns out. It's just, there's no other way to justify it. And so, I've been extracting reishi mushrooms. I've been extracting cordyceps. I've been extracting a whole bunch of functional mushrooms.
I just found a huge batch of golden reishi mushrooms in my yard here.
Oh, wow. That's a good find.
Yeah. I'm trying to get set up here at my house to be able to do some mushroom testing. I've got to my HPLC is falling apart. I really just need to get a new one. But I'm really excited about that, because once we moved to the Southeast, and that was something I missed when I moved to Oregon. I was like, gosh, being in the desert, like, there are mushrooms in Oregon and there's a huge mushroom culture, but in Mississippi, mushrooms are far more abundant. Yeah,
and it's everywhere. Totally. Yeah, I'm in Colorado, so we get like 3 weekends a year, maybe, I got nothing. That stuff has been fascinating for me, in part because I do see a lot of parallels with the cannabis industry, and it's exciting. Like, I do feel really rejuvenated by like seeing, like I've been to a couple of like the rallies for like getting it on the ballot and stuff. And I'm like, I remember feeling this way about cannabis. Like, I remember seeing, regulations change and like being like, I did this, like I remember, being a part of that. And it is, a very humbling reminder that like we have so much work to do. But then from the science perspective, we don't know nothing about mushrooms. And they are fascinating. And so, that analytical, kind of side project is just full blown now, because, when I'm looking at making live resin now, it's very much about making it consistent, and making it, scale up and be the same. And when I get to play with mushrooms, I'm like, everything is different. Like but weird stuff comes out. Some of it's cool, some of it's not. I've got this reishi extract that the aromatic portion of it smells like chocolate, like straight up cocoa chocolate. And it's like my favorite thing ever, because I smell cannabis terpenes all day, and like my job is great, right? Like people would love it, but I take it for granted until I get to go and make something different, so it's been really fun to play with all of that. And so that's what I think I'm going to kind of try to focus on with this podcast idea, is just running these tests at home to just see what we can see, just find out what's in there. Because when you don't have the regulatory requirement to check, when you don't, like, if business is bad for science, government is not better. So so it's just science for the sake of podcasting instead of government or business. I hope, so I just want to look at this stuff and pay attention to it, because I think it's really fascinating. I think it's really similar to what I've done in cannabis, and frankly, the people in the world of mycology, way cooler. Way cooler.
That's the world I came from before really getting into botany. Originally, I was, when I was still in Mississippi, I was primarily studying, mushrooms, and it's weird. I'm sure some people will disagree, but I agree with you that in general, the mushroom community is a little more chill, and very interested in understanding a lot of what's going on. And I don't know, it's funny to hear you say all this, because that's kind of where my head's at too. I'm in this process of really, I love everything that I've done with cannabis, and I still love teaching about cannabis and stuff, but it's more like, how do I take these core fundamental understandings that I've gained from working with this plant and really apply that to other plants and mushrooms and things, and start to ask similar questions that we would ask of cannabis, but ask them about these other natural products and what we can do with them in, interesting, creative ways.
Like if cannabis is this amazing, imagine what these other plants are doing. Yeah. Like wow, hold on. Yeah, exactly. And so I just love the newness of it. It just gives me so much perspective. When I look at the Medusa stone issue, it's fascinating to me because I'm trying to grow psilocybin crystals. And I have seen, in real time what a little fat bloom will do to like a tiny little crystal, and that little bloom happens and then the crystal goes away too. And I'm like, well, perfect. And it's like, and there's no way for me to winterize it exactly because my, compound's so unstable. And when I say no way, I mean no way yet.
Right.
But it, so I get to like see the same types of problems repeat themselves in other areas. And it's just like, it's so great to have that perspective and work it backwards. When I think about the two communities, what I love about the mushroom community is that there is a lot more commitment to green chemistry and renewable resources than we have with cannabis. And that's fascinating, because people who work in mushroom chemistry are trying to figure out how to use those mushrooms to replace their other reagents. So, you know what I mean? Like they're thinking of incredible things to make themselves better. And they're doing that without the regulation.
Right.
Without the government.
I mean, these mushrooms are
just for the sake of science. Exactly. So I love that part of the community. And that's kind of who I'm talking about when I say they're cooler. Not necessarily just people who are eating mushrooms, although they are fairly chill as well. But just kind of the industry behind mushrooms, like, if you think that that cannabis can be unsatisfying or financially non-rewarding, try making money off of mushrooms, because it's not happening. So like there's really no research. And so I love that aspect of it. It's, and it just makes it more fun because I find a lot of people in that mycology world who aren't big cannabis consumers. And so then I do find someone who thinks the way that I think, cares about the things that I do. And then I get to bring that cannabis knowledge to them while they, school me on the most basic, mushroom cultivation, tips and tricks that are out there. And so it's finding that new audience for, just the conversation, the information's almost less important than just like figuring out how we can, use it for and with each other, which I love. And there's a ton of opportunity there, I think. Like we can use mushrooms to get rid of our cannabis biomass and the ethanol. Amazing. Like there's so much there that, I can't wait, to learn more. Yeah. And I just hope that, in some way I can get other people to care more so that we can see it happen faster, because everyone who's passionate about, development and scientific advancement in cannabis or mushrooms will tell you that there's no funding. And the world is full of money. So there is funding. We just have to get it. And we get it by getting other people to care, especially the consumers.
Tickle the right ears. Well, this is exciting. I look forward to seeing how this all develops. And it's especially exciting for me to know you're working with reishi mushrooms. You're going to get a lot of questions from me about that as I start to play with them.
I've got my little vials, and I just I sit and look at them every day until this HPLC comes, because I've just made so many things that I can't identify yet. One of my trying to even so I've got all these little resins and all these little aromatics, I've got my chocolate one. There's just so much going on, and I'm obsessed.
I need to send you, so are you working with the the typical reishi mushroom, the Ganoderma lucidum?
So this is the downside to me as an extractor, because I don't grow weed and I don't grow mushrooms. So I'm out here just at the mercy of the people who do. So with the reishis, I've gotten a few different types, but they're always ground up before they get to me. which is convenient, but being the person I am,
you're right. Yeah.
I wanna see how hard it was to shred. Like that tells me a lot about what I'm gonna do next.
I was gonna say, I can send you some of the golden rishis we have here, which is a different species.
Yeah,
it has a different aromatic profile than the Ganoderma lucidum does, and obviously when they're ground, there's a lot you're losing too. But I don't have a ton, but I have a little bit I could send you.
What I'm obsessed with right now is I'm trying to get everyone to just give me fresh frozen mushrooms, because like shredding through the hard woody texture of those mushrooms is most of the process. You know, like almost everything you do after grinding it is a result of how well you ground it, or what that process looked like, or the degradation and everything else from there. And so getting my hands on fresh frozen mushrooms, that is where I'm getting the best results, because I'm just doing the same thing I have always done. You just put that thing in a column and you just hit it with a couple different kinds of solvents and you see what comes out. And that has been fantastic, in terms of just like the aromatic profiles that I can capture. There's no market for that. Nobody cares, but I am having a great time figuring those out.
Like, there's tons of ways to formulate with that in ways where people don't need to care. You can formulate in products to add certain elements to things that they will notice, may never know that it's coming from a mushroom or something like that. But there's so much. That's the more I learn, the more interested I'm in trying to formulate products at this point. It's like I've spent so much of my life studying products and understanding what's in them, and I'm like, I feel like I'm at the point like I'd really like to just make something that I feel good about, that I think is going to be useful to people, and that can take so many different ways. But I'm like, a lot of these mushrooms, they directly interact with the endocannabinoid system. They have all sorts of very interesting effects.
We could be using them in the grow to fight other fungus. We could be using them in the grow to fight pests. We could be using, like there are so many places that they could be helpful even without our consumption of them. And then you bring you bring your own body to the table, and it's like there's so much. I think of it like engineering my life, right? Like if once you learn that you love garlic, and then you just like start putting garlic in all your food, you just start enjoying your food because it's the way that you want it. And like, I can do that with my body at a chemical level. I'm all in, and that's all I'm doing is I'm just picking out more pieces. Like this is, like I'm thinking about these reishi as like the garlic of my, vitamins, like I need, these little pieces, and I love figuring it out. And I love, just like the tremendous amount of unknown, because most, oh my God, you want to get into the strain, species, whatever classifications of mushrooms? Are they animals? Like we've got a lot to, are they aliens? Yeah. Like there's a lot to answer with those. But it's fascinating to just have all of that like level of unknown, because I do think that is kind of where everyone's, sort of humble perspective comes from, is that we're just starting with a big question mark.
It's
and that's where I live.
It's like stepping out on a plateau and just seeing this huge, like unexplored valley, and saying like, okay, this is what we're stepping into. We're about to start trekking through, and we're all going to go in different directions to try to understand this valley and map it out. And then we'll discover more valleys after that. It's an exciting time.
Yeah, it's proof that I will always be busy, because I am not I don't have more free time. Like I have automated more pieces of equipment in my lab than ever before. The process is more standardized than ever before. We've got more staff than ever before. And somehow, like I am still very busy. So yeah, it's it's really fun to have new problems. I think it's a nice refresher.
It's good. Yeah. Well, this has been awesome. I've really enjoyed reconnecting with you, and especially in this way. I don't know the exact timing of this episode, but I feel like it's going to be close, because we started Yeah, this is going to be maybe a 2.5 hour. That's going to be awesome. So it's been awesome to sit down and reconnect. We'll have to do it again soon because there's a lot I want to talk to you about in the mushroom side of things that we have really only started to like kick the dust around on. So we'll have to do a follow-up where maybe we just talk about mushrooms.
I was thinking I would push scheduling this out further because I've got like maybe 2 more weeks or so before I get my column for the HPLC. The HPLC will be ready for me to pick up on Monday, but I don't have a column, so
you gotta wait for that to come in.
So I'm not excited yet. And then and then I'll still have like time to figure out everything else. But so I was like, oh, maybe I'll wait so that I have all of this cool stuff to talk about. But I was like, no, then I will because exactly. Well, and I'm like, who knows what I will find out when that happens, and that might not be more helpful. So we'll just talk about it upcoming because there's so much that like I am just so close to being able to say that I can't, but now I'm afraid to say because now I rely on analytics after after 10 years of not having them. Now I'm like don't want to move without them. Like I've got a couple jars that I'm like I'm not gonna take those out of solution until I get tests on these ones because like I could do something different, and I can't wait. I've been watching like just fun little reagents to kind of try and figure out what some of these are. I don't know if you've seen some of the reagents for identifying mushrooms. But and so it's just like it's the magic part of science. I'm like, oh, it turned blue and then red. Woo,
exactly.
Woo. Like, did you see it? It was blue for just a second. Like, I love it. So, so that part I can't wait to get more of, but I'll just be deep in that probably all summer. Forever. So I would love to see, if you see a cool mushroom, pop that thing in the freezer, because the fresh frozen is so much easier to work with.
Okay.
Because I mean, just think about shredding it in a blender, like a soft mushroom versus one that has been dehydrated. Most of the extraction process, I think, is so water heavy for these mushrooms because we're rehydrating it, and like that's backwards. Just leave the water in it.
Well, especially these polypores. I mean, they're just particularly. It's just a very different thing than. Mushrooms that someone would find growing, like mycorrhizal fungi or even saprophytic fungi that are like growing on duff and stuff in the forest. When you're dealing with these polypores that are growing out of wood, it's just
it is like grinding gravel. Like you're not. It doesn't.
Especially
like I can
Rishi's
see the whole polypores. Chunks of it. Like I've got my microscope out and I can still see like bark chunks. At like this tiny, like ultrasonic grinder powder size, and it's still like a whole piece with the red. And I'm like, break apart. What are you doing? Because it looks fibrous too, but then it isn't. It's fascinating. I love it. It's been so much fun to just kind of do something different for a minute, because the weed is going great, but it's that's almost the problem.
Exactly. It's becoming just the wheel turning in the background. Well, I have my other podcast that I do, Isn't Life Curious, that I'm starting to start back up now. And so our next conversation, we'll talk about mushrooms and we'll do it there. I think that'll be really cool.
Perfect.
Change of pace out of the cannabis world.
I'm loving it.
Cool. Well, thanks so much for being willing to
thanks for having me back.
This has been awesome.
For sure.
And anyone listening, this should come out before the workshop, I think. But Murphy will be participating in our upcoming workshop, our ultimate learning experience, as I call it. It's a huge 15-week educational series. It'll be extremely intense, definitely not for the weak-hearted, but Murphy will be joining us, talk all about extraction, and we'll probably spin out talking about mushrooms in that too, I imagine, because why not? And try to get people thinking about these things. So if you are interested in that and you haven't signed up, check that out. I still have a few scholarships I have not given away. So I'm trying to tell people, like, if you're interested in this workshop at all, apply for a scholarship. You will probably get one. So anyone listening, check that out at ultimate.cacpodcast.com. And yeah, as usual, everybody, thanks for, if you've listened all the way through, thanks so much for sticking it out through the whole conversation. That's fucking awesome.
Yep.
And
Appreciate you.
yeah, we will catch you again soon. So everyone out there, stay curious and take it easy, everybody.